Hello. Today, our group will be talking about our opioid crisis, which is the needle exchange centers. So, the overview of our ethical dilemma is that addressing the opioid crisis requires us to move beyond stigma and embrace harm reduction, services such as needle exchange and safe injection sites, as an ethical imperative. By applying the principles of human dignity and solidarity, we recognize that people who inject drugs are inherently worthy of care and that our primary moral obligation is the preservation of life. Rather than condoning drug use, these centers provide a compassionate, evidence based bridge to medical support and social services, serving as a viable framework to upload the sanity of life while fostering a more humane path toward recovery. The pros and cons of needle exchange centers. So, syringe services programs represent a critical intersection between public health initiatives and community-based concerns. On one hand, the advantages of these programs are significant, as they provide a safe needle exchange, offer sterile injection equipment, and serve as a proven intervention to decrease the spread of infectious diseases like HIV and hepatitis C. Conversely, these programs often face opposition based on the perception that they promote drug use. Fears regarding an increase in chronic diseases, transmission due to population concentration, and ongoing community anxiety over the improper disposal of use syringes in public spaces. Ultimately, while the specific consensus underscores the public health benefits of SSPs, effective implementation requires navigating these community concerns by emphasizing that formal exchange programs actually provide the necessary infrastructure to reduce public waste and link individuals to essential healthcare services. A case for needle exchange programs, not letting perfection be the enemy of the good. For our group stance, we support needle exchange centers. Our group firmly supports needle exchange centers as an ethical and evidence-based public health intervention. These programs help reduce the transmission of infectious diseases such as HIV and hepatitis C by providing access to sterile injection equipment and safe disposal options. In addition, they connect individuals with treatment, counseling, and recovery resources. The American Nurse Association of Code of Ethics calls nurses to advocate for the health and well-being of all patients without discrimination. Research shows that nurses are ideally placed to implement harm reduction strategies that meet patients where they are. As future nurses, we believe in advocating for interventions that promote patient safety, dignity, and community well-being.
So, our ethical rationale for supporting needle exchange centers starts with the fact that needle exchange centers reduce the spread of HIV and Hep C by providing sterile equipment and preventing needle sharing, which is strongly supported by public health evidence. These programs also uphold human dignity by providing non-judgmental care to all individuals, which is consistent with the nursing ethical responsibilities outlined by the American Nurses Association. From an ethics perspective, the harm reduction produced through these practices align with the nursing ethical duty of non-maleficence and harm reduction practice. Support for individual autonomy and informed decision-making is another nursing responsibility cited by the Code of Ethics that is fulfilled through these programs. In addition, needle exchange programs promote health equity by reducing barriers to care for marginalized populations who often experience stigma and therefore limited access to healthcare services. The Arizona Nurse Practice Act supports nursing advocacy and care coordination, which includes referring patients to appropriate treatment or support services, which aligns with the role of needle exchange centers in connecting individuals to treatment resources.
Our group's position is supported by professional nursing standards, legal principles, and current evidence. The ANA Code of Ethics emphasizes that nurses are responsibility to protect patient rights, promote health, and preserve human dignity. Research shows that the code continues to serve as a framework for ethical nursing decision-making and patient advocacy. Nurses are ethically obligated to provide care that is compassionate, free from discrimination, and evidence-based. State Nurse Practice Act requires nurses to practice safely and use evidence-based interventions to improve patient outcomes. Needle exchange centers align with these responsibilities because they reduce infectious disease transmission and connect individuals to healthcare services. The Patient Bill of Rights supports access to respectful care, informed decision-making, and equal treatment regardless of healthcare conditions or lifestyle choices. Research shows that harm reduction programs function as a wraparound care by connecting individuals with treatment resources, healthcare providers, and social support systems. Additionally, nurses are uniquely positioned to deliver harm reduction services and advocate for policies that improve community health while reducing stigma surrounding substance abuse disorders.
These are our references.